Hey everyone! Welcome back to the Spanish faculty. I'm Emma.
And I'm Alex. Today's lesson is for anyone working in healthcare who needs to communicate with Spanish-speaking patients.
We're teaching you practical hospital conversations, greetings, basic questions, simple instructions, and how to make patients feel comfortable.
These are phrases you can use immediately at work. Real conversations, real situations.
By the end of this lesson, you'll feel more confident speaking Spanish in a hospital setting, even if you're a complete beginner.
So stick with us because this could make a huge difference in how you connect with the people you care for.
Let's get started. All right, Alex, let's start with the basics. How do you greet someone in Spanish?
Hola, right?
Exactly. Hola is hello, simple and friendly.
What about good morning?
Buenos dias. That's for morning and early afternoon.
Buenos dias. What about afternoon and evening?
Afternoon is buenas tardes. Evening and night is buenos noches.
Buenos dias, buenas tardes, buenas noches. Got it.
Now, how would you introduce yourself?
My name is Alex.
In Spanish, you say, me llamo Alex, or mi nombre es Alex.
Me llamo Alex. Mi nombre es Alex. Both work?
Yes, both are common. Me llamo literally means I call myself.
Me llamo. That's easy to remember.
Now, let's put it together. Hola, me llamo Emma.
Hola, me llamo Alex.
Perfect. Now, what if you want to ask someone their name?
How do I do that?
You say, ¿Cómo se llama? That's the formal way.
¿Cómo se llama? When do I use formal?
In professional settings, always use formal. It shows respect.
Makes sense. Is there an informal way?
Yes, ¿Cómo te llamas? But stick with formal at work.
Got it. So ¿cómo se llama is the one I need.
Exactly. Let's practice. I'll ask you, ¿Cómo se llama?
Me llamo Alex.
Perfect. Now you try asking me.
¿Cómo se llama?
Me llamo Emma. Great job.
What if I want to say nice to meet you?
Mucho gusto. That's very important.
Mucho gusto. When do I use that?
After someone tells you their name, it's polite and warm.
So, hola, me llamo Alex. ¿Cómo se llama? Then they answer, and I say, mucho gusto.
Exactly. Let's practice that whole exchange.
Okay. Hola, me llamo Alex. ¿Cómo se llama?
Me llamo Maria.
Mucho gusto.
Mucho gusto. Perfect. You just had your first conversation.
That wasn't hard at all.
That wasn't hard at all. Now, what if you want to say, I'm a nurse or I work here?
How do I say that?
Soy enfermera if you're female. Soy enfermero if you're male.
Soy enfermero. What does soy mean?
Soy means I am.
So, soy enfermero is I'm a nurse.
Exactly. Or you can say, trabajo aquí. I work here.
Trabajo aquí. That's simple.
Now, let's put it all together now. Full introduction.
Okay. Hola, buenos días. Me llamo Alex. Soy enfermero. ¿Cómo se llama?
Perfect. That's exactly how you would introduce yourself.
I feel like I could actually do this.
You absolutely could. Now, let's learn how to ask basic questions. All right. After introductions, you need to ask some basic questions.
Like what?
First, how are you? That's ¿Cómo está?
¿Cómo está? That's the formal version.
Yes, the informal is ¿Cómo estás? But stick with formal.
¿Cómo está? What if they answer?
They might say bien, good, or mal, bad.
Bien, mal. What about so-so?
Así así, or más o menos.
Así así. Más o menos. Got it.
Now, a very important question. Are you in pain?
How do I ask that?
¿Tiene dolor?
Tiene dolor. What does tiene mean?
Tiene means you have, informal. So literally, do you have pain?
That makes sense. Tiene dolor.
And if you want to ask where the pain is, you say, ¿Dónde tiene dolor?
¿Dónde tiene dolor? ¿Dónde is where?
Exactly.
So I could ask, ¿Dónde tiene dolor? And they'd point or tell me.
Yes, they might say, aquí, here, or en el pecho, in the chest.
Aquí, en el pecho. What are some common body parts I should know?
Great question. Let's go through the basics.
I'm ready.
Head is cabeza.
Cabeza.
Chest is pecho.
Pecho.
Stomach is estómago.
Estómago.
Back is espalda.
Espalda.
Arm is brazo.
Brazo.
Leg is pierna.
Pierna.
Hand is mano.
Mano.
And foot is pie.
Pie. These are really useful.
They are. So now you can ask, ¿Dónde tiene dolor? ¿En el estómago?
¿Dónde tiene dolor en el estómago? That's like confirming, right?
Exactly. You're helping them tell you.
What about asking how long have you had this pain?
That's a bit advanced, but you can ask, ¿Desde cuándo? Since when?
¿Desde cuándo? That's useful.
They might say, desde hoy, since today, or desde ayer, since yesterday.
Desde hoy. Desde ayer. What's week?
Semana. So since last week is desde la semana pasada.
Desde la semana pasada. Okay.
Now, let's talk about yes-no questions.
Like what?
Do you have allergies? That's ¿tiene alergias?
¿Tiene alergias? Simple.
Do you take medication? ¿Toma medicamentos?
Toma medicamentos. What's toma?
Toma means you take, informal.
Got it. What about, do you feel dizzy?
Se siente mareado, for male. Se siente mareada, for female.
Se siente mareado, mareada. What does that literally mean?
Se siente means you feel. Mareado is dizzy.
So I could ask, ¿se siente bien? Do you feel okay?
Perfect. Yes. What about, do you need help?
Necesita ayuda.
Necesita ayuda. That's important.
Very. And can you walk is puede caminar.
Puede caminar. Puede is can you?
Yes, informal. Caminar is to walk. These questions are really practical.
They are. Let's practice a few together.
Okay. ¿Cómo está?
Mal.
¿Tiene dolor?
Sí.
¿Dónde tiene dolor?
En el estómago.
That was like a real conversation.
Exactly. Now, let's learn how to give simple instructions. All right. Now, you need to know how to give basic instructions.
Like what?
First, please sit down. That's siéntese, por favor.
Siéntese, por favor. What's siéntese?
It's the formal command for sit down. Por favor is please.
Always use por favor?
Always. It's polite and respectful.
What about stand up?
Levántese, por favor.
Levántese, por favor. What about lie down?
Acuéstese, por favor.
Acuéstese, por favor. These are really useful.
Now, open your mouth. That's abra la boca, por favor.
Abra la boca, por favor. Boca is mouth.
Yes, and close your mouth is cierre la boca.
Cierre la boca. What about eyes?
Open your eyes is abra los ojos. Close your eyes is cierre los ojos.
Abran los ojos. Cierre los ojos. Ojos is eyes.
Exactly. What about breathe deeply?
Respire profundo, por favor.
Very. And don't move is no se mueva.
No se mueva. When would I use that?
During procedures, when you need someone to stay still.
Makes sense. What about relax?
Relájese or cálmese. Calm down.
Relájese, cálmese. Both work?
Yes. Relájese is more gentle. Cálmese is if someone's anxious.
What if I need them to wait?
Espere, por favor. Wait, please.
Espere, por favor. What about come with me?
Venga conmigo, por favor.
Venga conmigo, por favor. Conmigo is with me?
Exactly.
What about directions, like turn left or turn right?
Good question. Turn left is doble a la izquierda,
Doble a la izquierda. And right.
doble a la derecha.
Doble a la derecha. What about straight ahead?
Siga derecho or siga recto.
Siga derecho. That's useful for giving directions.
Very. Now let's talk about comfort phrases.
Comfort phrases.
Yes, things you say to make someone feel better.
Oh, like what?
Everything is okay is todo está bien.
Todo está bien. That's comforting.
Don't worry is no se preocupe.
No se preocupe. What about I'm going to help you?
Voy a ayudarle.
Voy a ayudarle. That's really kind.
It is. And this won't hurt is esto no va a doler.
Esto no va a doler. Though sometimes it does hurt a little.
True. You can say un poquito, a little bit.
Un poquito. So this will hurt a little is
Esto va a doler un poquito.
esto va a doler un poquito. Honest but gentle.
Exactly. What about asking, are you comfortable?
How do I ask that?
¿Está cómodo? For male. ¿Está cómoda? For female.
Está cómodo? Está cómoda. That's thoughtful.
Very. And do you need anything? Is necesita algo?
Necesita algo? So caring.
These phrases really help build trust.
I can see that. They show you care.
Exactly. Now let's practice some realistic conversations. All right, let's put everything together with some realistic scenarios.
I'm ready.
Scenario 1. You're meeting someone for the first time. I'll be the patient.
Okay. Buenos días.
Buenos días.
Me llamo Alex. Soy enfermero. ¿Cómo se llama?
Me llamo María.
Mucho gusto, María. ¿Cómo está?
Estoy nerviosa.
No se preocupe. Todo está bien.
That was perfect. You greeted, introduced yourself, and offered comfort.
It felt natural.
Scenario 2. Checking on someone's pain.
Ready? Yes. ¿Tiene dolor?
Sí, mucho dolor.
¿Dónde tiene dolor?
En el pecho.
¿Desde cuándo?
Desde hoy.
Voy a ayudarle.
Excellent! You asked where, when, and offered help.
This is making sense.
Scenario 3. Giving instructions during an exam.
Okay. Siéntese, por favor.
Sí.
Abra la boca, por favor.
Okay.
Ahora cierre la boca. Respire profundo.
Okay.
Perfecto. Todo está bien.
That was great. Clear, polite, and professional.
I'm feeling confident.
One more scenario. Helping someone find a room.
Okay, I'll try. Venga conmigo, por favor.
Okay.
Doble a la derecha.
Okay.
Siga derecho.
Okay.
Aquí está.
Perfect. You gave clear directions with confidence.
These scenarios really help.
They do. Now let's talk about a few more useful phrases.
Like what?
I'm going to take your temperature is voy a tomar su temperatura.
Voy a tomar su temperatura. What about blood pressure?
Voy a tomar su presión.
Voy a tomar su presión and pulse.
Voy a tomar su pulso.
These are really practical.
Very. And I need to is necesito. For example, necesito ver su brazo.
Necesito ver su brazo. I need to see your arm.
Exactly. You can use necesito with lots of things.
Necesito ver, necesito tomar. That's useful.
What about asking permission?
How do I do that?
May I is puedo. For example, ¿puedo ver su mano?
¿Puedo ver su mano? May I see your hand?
Perfect. It's polite and respectful. What about explaining something will be quick?
Va a ser rápido. It's going to be quick. Va a ser rápido. That's reassuring.
Very. And just a moment is un momento.
Un momento. Simple.
What if you need to call someone?
Like a doctor?
Yes. I'm going to call the doctor is voy a llamar al doctor.
Voy a llamar al doctor. That's important.
Very. These phrases help you communicate next steps. All right, Alex, let's review everything we've learned today.
Sounds good. Where do we start?
How do you introduce yourself?
Buenos días. Me llamo Alex. Soy enfermero.
Perfect. How do you ask someone's name?
¿Cómo se llama?
Great. How do you ask, are you in pain?
¿Tiene dolor?
And where is the pain?
¿Dónde tiene dolor?
Excellent. How do you say, please sit down?
Siéntese, por favor.
Open your mouth?
Abra la boca, por favor.
Don't worry.
No se preocupe.
I am going to help you.
Voy a ayudarle.
That's fantastic. You've learned so much.
I really feel like I could use these at work.
You absolutely could. And remember, even knowing a few phrases makes a huge difference.
Right. It shows you're trying to connect.
Exactly. People appreciate the effort, even if you make mistakes.
What should I practice first?
Start with greetings and introductions. Use them every day.
Buenos días. Me llamo Alex. Got it.
Then add the basic questions. ¿Cómo está? ¿Tiene dolor?
¿Cómo está? ¿Tiene dolor? I can do that.
And practice the comfort phrases. No se preocupe. Voy a ayudarle.
Those make such a difference.
They really do. What's the most important thing to remember?
Always be polite and use por favor,
Yes, and speak slowly and clearly.
even if my pronunciation isn't perfect.
Especially then, clear is better than fast.
What if someone speaks too fast and I don't understand?
Say, más despacio, por favor. More slowly, please.
Más despacio, por favor. That's useful.
Or, no entiendo. I don't understand.
No entiendo. It's okay to say that?
Absolutely. Honesty helps communication.
What about if I need someone who speaks Spanish?
You can say, necesito a alguien que habla español.
Necesito a alguien que habla español. Good to know.
But honestly, with what you learned today, you can handle many basic situations.
I'm actually excited to try.
That's the spirit. So everyone watching, here's what to do next.
Practice these phrases out loud, even if you're alone.
Yes, say them in the mirror, in your car, wherever.
The more you practice, the more natural they'll feel.
And try using one phrase tomorrow at work. Just one.
Like, buenos días, ¿cómo está?
Perfect. Small steps lead to big confidence.
If you found this helpful, please give us a thumbs up and subscribe.
And leave a comment. Tell us which phrase you're most excited to use.
Or let us know if you want more lessons like this.
We're here to help you communicate with confidence.
Thanks so much for watching, everyone.
You're going to do great. Keep practicing.
Hasta la próxima.
See you next time.